Hi, I am Adam Pearson. I am a licensed mental health provider and have a master's in clinical psychology. I have two doctorates. I went for a PsyD, which is a doctor of psychology, and an EDD, Doctor of Education and Counseling Psychology. I just did not do the dissertations because I did not want to be called doctor. People get an ego and it affects therapy. But I want to talk about what I'm doing now, which is providing mental health evaluations for veterans. Um, I have practiced for 14 years, and I'm going to get to the point. The VA government does not like paying out, uh, well, to anyone, in my opinion, but does not like providing veterans their mental health uh, benefits or their you can do a claim for mental health and you can do a claim for physical. That's kind of my first lesson is that there's two, and many veterans don't know that you can request benefits for physical injuries and mental health. And most of the time, a physical injury that causes debilitation in your life, such as, let's say, your back was broke and your quality of life is diminished, which causes depression, which causes anxiety, can cause PTSD, and so they're usually intertwined. I have provided many veterans mental health evaluations for the last. I've done it off and on, but for the last year, and I really enjoy working with veterans. And when I found out how corrupt, to be honest, the VA is, excuse me, my allergies bother me. Um, to a quick summary, when in the process, so let's say David is a veteran and he's suffering from depression, PTSD, and most of the time, uh, veterans have 2 to 5 mental health diagnoses. And what they're looking for in your claim is how it's affecting your personal, social, and occupational areas of your life. And so let's say you to submit your claim. Okay, when you go to submit your claim, you are going to want every record of any mental health treatment, consultations, medications. So a mental health evaluation includes typically clinical interview, diagnoses, symptoms, and psychological testing or assessments. And so psychological testing and assessments are equivalent to like an x-ray for a broken bone. And in a court of law, and that's how I write. The mental health evaluations I write are as if I'm going to a court of law because it really is uh, proving that you have issues stemming from your service in whatever branch of the military it was or is. And so, so what happens? You want to go with it, and that's evidence. And a clinical interview is where I ask you questions. You know, what are your symptoms? How are they affecting you? Um, is the assessments, psychological testings are objective. They are stronger in a court of law than my clinical interview. So I also provide you those to turn in with your claim, and which makes it very hard for them to deny your claim to get your benefits. And so, just like let's say you go to Blue Cross or Anthem or Cigna, you turn in a claim for a broken leg and the bills that go along with that. Let's say that was fake. Well, that would be fraud. Well, for the insurance company to deny a claim, they have to prove that it was valid to deny your claim, or that's fraud. The same goes for the VA. But so let's say David goes and has no mental health history to turn in, no paperwork, no history, no records. Then he will see a VA, approved psychologist or psychiatrist, and you're flipping a coin whether how much they care and how much the VA has influenced them. So after that happens, it goes to an educator. Educator is the one who stamps approved or denied on your mental health claim or your physical. So you can Google, this is common knowledge. Educators are not medical professionals at all. Most have no medical training, and they get bonuses based on how many claims they deny. And some VAs, and most VAs, they get in trouble if they've approved too many. So the VA, and that's traumatizing to some veterans. The VA is supposed to be where you go to get help, and they will fight you, and especially if you have a diagnosis of PTSD, which I would explain, which they kind of use that one and make you prove everything, where you were, which it isn't that complicated. But for someone, you really, before you submit a claim to the VA, you want to know the dynamics. And that's what I do. I am objective. Like when so a mental health evaluation, I'm going to be objective, and I talk to your family members and friends, typically too, or I get a letter from a couple of them, because they are witnessing, and like in a court of law testifying, they write, a summary of how the symptoms are affecting your life. So so we got your mental health evaluation, your assessments, the support letters, and that's all evidence. And so the psychologist or the psychiatrist for the VA, by law, is supposed to review all medical records. Everything you submit is medical records, as in the evaluation and the assessments. And the assessments are objective. So let's say I'm giving you the PHQ-9. That's patient health questionnaire. That's measuring for depression, and if it's mild, moderate, severe. That is an objective test. Just like if you go for an STD test. If you test positive for syphilis, you got syphilis. So that's why it's important. And any mental health provider or medical provider, same thing, and can provide mental health evaluations. But some do not include psychological testing, which is that's another reason I'm doing this, is because I am dumbfounded they don't. And my dad is a veteran, and I want to serve those who have served. And I am very transparent. I will also, I provide treatment recommendations for what you're suffering from, because there are 2 breakthrough treatments, which I would get into if you're a client, but that are more of a cure for PTSD, anxiety, depression, chronic pain. Okay, so in a mental health evaluation, typically I can get that. We're done within a week, and I point you to people that there's 1 to 2 so far that I refer clients to that actually care. And one of them was an educator who quit the VA because he saw how corrupt it was. That he would get a bonus based on, and they encourage him, deny, 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 and he would get a vacation or get in trouble if he approved too many. So he helps veterans with the VA just like an attorney would. But there are also companies, individuals, and they will say veteran owned, and they're veterans. But there's one that I'm not going to mention names. I don't badmouth. But they typically make $10,000 to $12,000 off your benefits for helping you do what really is not hard. But it can be overwhelming if you have anxiety and depression, and some people, but typically you just you find the local VA, or you can go online and submit your claim. But these people help prepare you to help with your interview with the VA psychologist or psychiatrist, because they will give you leading questions trying, for example, they might ask, so you're claiming you have depression. Is there any chance that your depression started before you entered the military? And so they're kind of leading. They're looking for anything to help prove that there's a possibility that, oh no. So and when I finished grad school, I was trained for 2 years uh, in my residency by a psychiatrist who is also an attorney. So, and sometimes it depends what VA you go to, but sometimes my mental health evaluations are so strong that they cut out the middleman, which is the VA psychiatrist or psychologist, and it goes right to the educator and gets approved. And that's not every time. In fact, that's going to be more minimal, but it does happen. So, in a mental health evaluation, you want to be honest and transparent with me. You want do not and malingering is a clinical term which just means lying. Obviously, you don't want to do that. I support veterans. I support your symptoms, and no veteran is going to have to malinger. I've not seen one that they might try to maximize, like, oh, this is affecting me so much I haven't slept in 10 days. Well, if you haven't slept in 10 days, you're going to be in the hospital. But that doesn't typically happen. And so I'm objective. This is your diagnosis, your symptoms. I write it up for you. I have a rough draft. I have you review it, make sure I did not confuse anything or miss anything. And I'm going to be objective in my diagnosing and symptoms, but I'm going to care for you. I charge $500. It does sound like a lot of money, but and you can again Google. I research, and most psychologists, psychiatrists who provide mental health evaluations charge the typical range is $800 to $2,000. And it does take, for me, it takes, I put in 5 to 8 hours average. And, you break that down, and most, therapy sessions are $75 to $150 an hour. So you can do the math there, but it's a flat $500. Whatever state you're in, I can provide that for you because it is federal. I am licensed in 9 states. But because this is an evaluation and it's federal, because it's different if it would be therapy. If it was therapy, I could only see a patient, for example, in Colorado, Missouri. You can look me up as well if you like, Adam Pearson. You can Google Adam Pearson, Psychology Today. There I am. And they have to verify, of course, that I'm licensed and so forth, credentialed. And so I will work with you and your family, your support system, and guide you. And then my job is over. And then when you turn in your claim, and I kind of look, if you have a physical injury, I will say, hey, have you turned in a claim for the physical? Because the VA is not going to shout out these things to you that you can get disability per month for physical and mental health. And the average, it depends. There's different ratings as well for a mental health claim. So if they approve it, it's going to be 10%, 30%, 50%, 70, or 100. There's not been one veteran I have not seen that does not qualify for the 70%. Most, because at 70%, your symptoms are typically the one that they typically approve automatically is if you have passive suicidal ideation. That is where a person, and most people with depression are going to have this, have thoughts of, it'd be easier if I wasn't here. I wish I could fall asleep, wake up in heaven. That's passive. Active suicidal ideation or homicidal ideation is having a plan, intent, desire, motivation to kill yourself or others. You're not going to typically get ever 100% mental health disability in the VA, because veterans like that are typically suicidal or homicidal. The ratings are based upon symptoms, not the diagnoses, which I include those, but it's the symptoms and their impact on your life. Again, personal, occupational, and social. But 100% is where you're either psychotic 24/7, you're suicidal or homicidal, you're a risk to yourself and others, and you're institutionalized. So most are going to be 70%, some 50%. And that's the nuts and bolts. I see all patients through phone and video, and I will send you your assessments before I see you. You can they're self taken. Some I give to you during the clinical interview. It just depends. Everybody's different, but I crank them out, get them done, so you can move along in the process. When you turn in your claim, typically it's about 3 to 6 months. I try to give as much information, but I do it in chunks, because most veterans, as you all know, if you're watching this, you're either a family member or a veteran, but the military will, during your time, don't seek help. You're weak if you get help. Well, you're kind of brainwashed, and well, I have depression or PTSD and I'm having nightmares and I can't sleep. But if I ask for help, and a lot of times you're bullied, you're made fun of, which is verbal and emotional abuse, you're ostracized, you are treated different, you're looked down upon. But if you did seek help or therapy or mental medication in the military, you want all the records, which I'll help you with and guide you with all that. But my point is, most veterans have not sought mental health treatment, or very little. And so when I'm doing even a clinical interview, grief starts or you're triggered. And so I do it in chunks. Like I might send you the psychological testing, I send you a questionnaire, then we do the clinical interview, then I have you review your rough draft, and then I'll sign and date that we'll finalize. And you're going to see in the mental health evaluation language it's from the 1800s. The VA system is very weird in some ways, and so for example, I would write, it is more likely than not, I decree, or something like that. I decree that it is more likely than not that John Smith has major depressive disorder, recurrent, unspecified, due to his service in the military. And then I repeat that. So I have learned the lingo. I have researched and listened to many attorneys, veterans, educators, and I have a system, and typically it works. But you don't have to pay me $10,000. Like there's a lot of companies out there that are, which is the world we live in, unfortunately, that are feeding off the money you can make from your disability. And they don't really do that much, to be honest, because what they do is, you can watch a couple YouTube videos and learn, or I would work with you for a little bit extra, but coach you, and because they will try to mess you up a lot of times at the interview with the VA approved psychiatrist or psychologist during the claims process. But you can always appeal it, and that's because, once again, when they deny a claim, they got to prove that there was doubt. So if I diagnosed you and have symptoms and you have assessments, then it goes to court of law, because that's a crime. That's fraud. That's a misdemeanor or felony committed by the VA. So you can appeal that and fight back, and I would, advise you who to go to if you wanted. I meet people where they're at. I don't dance around. Um, I usually will tell you where I think your rating would be, um, which will determine how much money you're given per month. Which average was, I think, I'd say between $1,750 and $3,000. And but if you also have a physical claim, that's so I don't know how much that is, but let's say it's 2,000 a month. You're looking at 5,000 a month in disability. So I hope this helps. You can contact me. You can comment on here. You can find me on Psychology Today, Adam Pearson, Pearson. You'll see Pearson Psychological and Evaluation Services. You can email me, Adam Dale, Dale, 1977 at gmail.com. You can text, call me. I have 270-217-8888. I'm very open and transparent. You don't have to like the videos. You don't have to subscribe. You can if you want. That's great. I'm just here to serve you and help you. And so, once again, if you're in the United States, any of the 50 states, I can help you and provide you with the mental health evaluation. And that's what you want. You are 5 times more likely, I'd say probably 5 to 10 times, than a veteran who is suffering and goes in the VA and has no medical records. You want all the records or evidence, just like in a court of law. And I try to make it near impossible, if not impossible, for them to deny your claim as long as it's valid. But any veteran I've ever seen, there's no question they do not have 2 to 5 diagnoses or addiction. A lot of people a lot of veterans, this is not rocket science, have alcohol abuse or addiction because of their military service, because of the trauma, and it's all connected. So I hope this helps. You can post any questions, contact me. I'm on Facebook, Adam Pearson, Pearson. I have a Facebook page that's being developed actually this week, that's just dedicated for this. And that's all I'm going to be doing from this point forward, because I want to serve those who have served. And I want to help get your benefits that is due to you. And because you have trauma. Trauma is trauma, but you all have complex trauma. I mean, boot camp alone is traumatic. And so, anyway, please let me help you. I bust my tail for you. I am honest, and I will point you to others that will help you file your claim. And I guess that's it. So, thank you for serving. I hope to serve you. And have a blessed day. Thank you.